We here at KTVB, as a company, as a news organization, have embraced and encouraged the facts, not fear mentality when it comes to the coronavirus. Fact is, it's in the Northwest. It has reached the fatality stage with 9 deaths now in the Seattle area due to the COVID-19 strain. 5 of those deaths, by the way, were residents of the same Life Care nursing home. 27 of the country's 108 cases come from Washington. And sure, there has been some fear with that, with several Idaho and Treasure Valley students possibly exposed to the virus at a music festival that is in North Idaho last week, where Washington students were also in attendance. Fact, nobody in Idaho has been diagnosed with the coronavirus. And according to the Department of Health and Welfare, only 3 people have been tested for it across the state. Results, negative. And only 6 are under supervision right now. Another fact, there is a state basketball tournament about to tip off across the Treasure Valley this week, and that may drum up some fear in those who are planning to attend. That tournament, still a go. The Idaho High School Activities Association told us they've been in discussion with Health and Welfare, and at this point, they have no concern about holding a boys basketball state tournament or anything else. There have been no changes to the schedule of the upcoming 2020 IHSAA Boys Basketball Debate, Cheer, Dance State Championships. That's the opening line to a statement they put out this morning, and it goes on to say that they're working with tournament site staff to make sure that all high traffic areas, surfaces in those areas that would be touched, well, they're going to make sure they're properly cleaned before and during those games. They're also making sure soap and water or hand sanitizer, there are stations set up that are easily accessible, and they will be promoting appropriate respiratory etiquette and hand hygiene practices. That cough into your elbow, stop touching your face so much, that kind of stuff. And yes, they have hired extra staff to make sure those venues are taken care of properly. So how big of an undertaking is this? From Thursday through Saturday, there will be 66 games at 7 sites from Caldwell to Boise when it comes to the boys state basketball tournament. 48 teams with all of their staff, students, fans, and families, to the tune of tens of thousands of people from all over the state coming together at the Ford Idaho Center and Treasure Valley High School gymnasiums. We spoke with Ty Jones, the executive director of the High School Activities Association, this afternoon, and he told us cost, not a concern when it comes to cleaning, and they're moving forward with the tournaments cautiously.
We're as prepared as we can be at this particular time. Honestly, our tournament will probably be safer than it ever has been in the past, just because of the precautions that our tournament managers and our facilities have taken so far. The best thing for people to do, if they're sick, they need to stay home. If they have questions or concerns, call us or call their schools, and the information that we're sending out is what we have right now, and hopefully it's enough to alleviate a lot of those fears.
Ty told me they haven't had any phone calls or questions from parents or schools expressing concerns about this week's tournaments, but they will continue to monitor this situation along with the health and welfare because, as we've seen, it can change rapidly. The tournament is just the tip of the coronavirus iceberg, though, when it comes to the questions we have had in the newsroom. So Gretchen Parsons has been looking into answering as many of those questions as she can today. And Gretchen, what have you found out?
Well, Brian, one question we've been getting a lot because coronavirus is so new and novel. A lot of people have been asking us, how can they get tested, right off the bat so they can maybe have some peace of mind? Well, it's not that simple. If you feel sick, like a cough, fever, maybe feeling achy, go to your primary care doctor. There, they will test you for the flu or the common cold, which you're much more likely to have than coronavirus. However, if your primary care doctor determines you meet the criteria to get screened for coronavirus, for example, you've traveled to China or you've come into direct exposure with someone who's been sick, then they'll take a swab and send it off to the state of Idaho, where they will determine if you have the virus. I asked Brandon Atkins with Central District Health how much that costs and how long it would take to get those results back.
So if a person does meet the criteria and the sample is submitted, it is then sent forward. In our state, for example, it would go to our state lab and be processed at no cost out of pocket to that client. The thing that is really important about this is that once the state lab has run this test, they still have to send the test on for verification through the CDC. So I would say 2 weeks is probably a very early guideline for it.
Brian, so there you go.
So it's not an overnight process.
Exactly. It's not an overnight process. The test is free, but it would take about 2 weeks for results. However, Atkins says once a coronavirus test is commercially available, it would probably cost around under $25, historically speaking, with other vaccines. And another question we've got a lot of, Brian, is how long can the coronavirus live on the surface of something?
Like this table
Like
right here.
this desk, exactly. Atkins answered that too.
Other viruses can live for weeks to months on surfaces. Coronavirus probably doesn't have that same, like a hepatitis A, for example, or a hepatitis B that could live on a surface for a very prolonged period of time. But it still has the shelf life. I would anticipate easily a week.
Now, the CDC says a week is maybe on the long end of
Sure.
the spectrum, and it does vary depending on what type of surface also. So maybe it could be much less than a week. And also packages coming from China, that also very low risk getting infected that way as well. But there is a chance.
All right. That's good information. Thank you very much, Gretchen. It's something we get a lot of phone calls into the newsroom as well. I also recommend getting a flu shot, though, if you haven't this year. I know it's not the same strain, but the flu is way more common and it affects much more people in the U.S. compared to coronavirus. So keep that in mind. Well, every time we talk about the coronavirus, we get a steady stream of phone calls into the newsroom. We had one today from a man asking if he could sue the school if his child got coronavirus because they wouldn't let him send him to school with a mask. We had two other phone calls today within minutes of each other. One claiming we are downplaying the coronavirus, another that we're hyping the fear. We aren't trying to do either. We're hoping to offer up facts over fear. But this is going to go on for a while. Coronavirus, not going to go away tomorrow, next week, and maybe not by next month. You might be, or might get sick, I should say, of hearing about it. We might get sick of telling you about it. But in the end, let's hope we don't get sick from it. Facts. You don't need a mask. You do need to wash your hands often and well. You do need to cover your coughs and sneezes with your arm and stop touching your face so much. You don't need to change your life. Keep going to school, keep going to work, to practices, to sporting events. But even if you do all of this precautionary stuff, you may still get sick. And if you do, then don't go to work or don't go to school. Do not go out in public. Do, though, prepare to stay confined at home for an extended period of time. In fact, fact-based preparation, even in just small doses, might be just enough to keep us from letting our fears get the best of us in what is certainly to be uncertain times.